Welcome to our education video Chronic Kidney Disease, CKD. In this video, you will get to learn more about everything you need to know before choosing the options for your kidneys.
Why are the kidneys important to our body? Let's find out the functions of the kidneys in the body and how it plays a part in our system. Firstly, they release hormones that regulate blood pressure, control pH levels, help with reabsorption of nutrients such as glucose, amino acids and phosphate. They also assist with osmolality regulation. The kidneys also act like a filter, remove waste and extra fluid from the body, produce active form of vitamin D that promotes healthy bones. Lastly, they control the production of red blood cells.
Have you wondered how can one get chronic kidney disease? Well, this may be surprising, but there are a few health illnesses that could lead to chronic kidney disease. Here are the 5 main health issues: diabetes, hypertension, glomerulonephritis, genetics, and urinary tract obstructions. 440,000 Singaporeans had diabetes in 2014. The number is estimated to go up to 1 million by 2050. Diabetes happens when your body does not make enough insulin. Insulin is a hormone that helps to control how much sugar is in the body and keep it to a limited amount. High sugar level in the body can cause many complications of the organs found in our body. This can include the heart, kidneys, eyes and brain. Over time, this can result in kidney disease and kidney failure. Blood pressure refers to the force of the body's blood pressing on the inner wall of the arteries. Each time the heart contracts, it pumps blood into the arteries. A healthy blood pressure reading should be lower than 120/80ths of a millimeter of mercury. A blood pressure of 140/90ths of a millimeter of mercury or higher indicates high blood pressure. High blood pressure can cause damage to the kidneys, brain, eyes and heart. Glomerulonephritis is inflammation and damage to the filtering part of the kidneys. It can come on quickly or gradually. It can occur on its own or part of another disease. Severe or prolonged inflammation can damage the kidneys. One of the genetic kidney diseases is polycystic kidney disease. Polycystic kidney disease is caused by fluid-filled cysts that grow in the kidneys which reduce their functions. Urinary tract obstruction is the blockage of the urine flow. It can be due to stones, cancers, or prostate enlargement in males. There are 5 stages of chronic kidney disease. The stages are determined by the estimated GFR test result and how well your kidneys filter your wastes and excess fluid. As the stages increase, kidney function reduces. Kidney replacement therapy is required at stage 5.
In the early stages of CKD, most patients will not experience any symptoms. However, as CKD progresses, patients may experience the following symptoms: nausea and vomiting, uremic breath, itch, shortness of breath, fractures, poor appetite, increased leg swelling, abnormal heart rhythm, and loss of energy.
Here is an overview for the options patients can take for end-stage kidney disease. Kidney transplantation, kidney replacement therapy or dialysis, and kidney supportive care. Under kidney replacement therapy or dialysis, you can choose either hemodialysis or peritoneal dialysis, PD. Under PD, patients can choose continuous ambulatory peritoneal dialysis or automated peritoneal dialysis, which will be further elaborated later on. The first option available for end-stage kidney disease patients is kidney transplant. What are the types of kidney donation? Living-related kidney transplant such as parents to children or amongst siblings, cousins. Living unrelated kidney transplant such as spouse, friends, altruistic donors. Deceased donor kidney transplant. Certified brain-dead person donating to a common pool under the Human Organ Transplant Act. Living donation is associated with better outcomes as compared to deceased donation. All living donors will be carefully evaluated for suitability prior to donation. These potential donors will need to be healthy and free of kidney disease, diabetes, poorly controlled high blood pressure, cancer, and active infections including HIV, hepatitis, and other infections. In general, kidney transplant is associated with more advantages than disadvantages. Here are the advantages and disadvantages of kidney transplant. When the patient chooses kidney transplant, the patient will have higher survival rate than being on dialysis, better quality of life, dialysis is not required, higher energy level, fewer dietary restrictions, easier to travel, and work as well as chance of having children. However, the disadvantages of kidney transplant include risk of organ rejection which required lifelong immunosuppressants, risk associated with major surgery, increased risk of infections due to reduced immunity, increased risk of cancer and recurrence of primary kidney disease. The second option available for end-stage kidney disease patients is peritoneal dialysis. Peritoneal dialysis, also known as water dialysis, is a type of dialysis which uses your own membrane as a filter to remove extra water and toxins. This dialysis procedure can be done at home. In peritoneal dialysis, a small and soft tube will be placed in your abdominal cavity, to allow fluid to be filled into, and removed from the abdomen at regular intervals for dialysis. A soft plastic PD catheter is inserted into the abdomen as a surgical procedure. The wound heals over 10 to 14 days. You will be trained to perform PD once the wound is healed. Training occurs over 5 days at the hospital. Patient and caregiver must be present for the training. The picture on the right shows the location of the catheter. There are two types of peritoneal dialysis: continuous ambulatory peritoneal dialysis, also known as CAPD, and automated peritoneal dialysis, also known as APD. CAPD is performed manually. Each dialysis exchanged is performed over 30 minutes. The patient can continue with their daily activities until the next exchange occurs. This exchange consists of a connect, drain, fill and disconnect, dwell period. Connect refers to connecting oneself to the dialysate bag and drain bag via the catheter. Drain is the removal of dialysate from the peritoneal cavity. Fill is the process of the new dialysate is introduced into your peritoneal cavity. Disconnect or dwell is when you disconnect yourself. The new dialysate is left inside your peritoneal cavity until your next exchange is due. CAPD is usually done 4 times a day. For example, in a day, it can be done before breakfast, before lunch, before dinner, and before you sleep. Here is a photo of the approximate space required to store the dialysis solution. Costing and subsidy for peritoneal dialysis will be explained during counseling session. Automated peritoneal dialysis, also known as APD for short, is the second type of PD which is performed using a PD machine at night while asleep. Similar to the process of CAPD, it performs the fill, dwell and drain period of each cycle so that you can sleep without any disruption. You will connect yourself to the PD machine just before sleeping, and it will remain attached to the machine for 8 to 10 hours every night. After 8 to 10 hours, you can disconnect yourself from the machine and continue your daily activities. There are 2 types of APD machines available. More photos on APD machines with trolley. Here is a photo of the approximate space required to store the dialysis solution. Costing and subsidy for peritoneal dialysis will be explained during counseling session. Even with kidney issues and a full-time office job, 32-year-old Mrs. Chi can still afford to have an active lifestyle.
Hey Mrs. Chi, back from work? How have you been? I heard from your mother about your kidney issue?
Yes, Madam Lee, I just finished work. I am managing my kidney issue by doing peritoneal dialysis on my own at home.
After Mrs. Chi decided to go for a run in the park, she had to then head home to do APD. And through the night, Mrs. Chi does her APD routine before waking up to go to work. Here are the advantages and disadvantages of peritoneal dialysis. Advantages would include that PD is a home-based therapy, freer needles, better protection of remaining kidney function, lesser diet restriction, and it is also less expensive. At the same time, There is less traveling overseas when you are on PD, as you can contact your PD nurse so that they can make logistic arrangements with the vendors so that they can supply the dialysis solution to the hotel for you to do your dialysis. Disadvantages would include that being on PD means that you need to be on dialysis on a daily basis. You may also require a caregiver to help with dialysis if you are not able to do it alone. Diabetic control may be more difficult, potential risk of abdominal infection, and you would also need space at home to store the dialysis equipment. The third option available for end-stage kidney disease patients are hemodialysis. Hemodialysis, also known as blood dialysis, is a medical procedure that helps remove waste products and excess fluids from the bloodstream as the kidneys are no longer able to perform their normal functions effectively. Blood is drawn out and cleansed using a dialysis machine. It is usually done 3 times a week. Each session lasts for about 4 hours and it is done at community dialysis centers. A needle is inserted into the access to draw blood out of the body into the machine. Another needle returns the filtered blood to the patient. To obtain blood, a vascular access is surgically created to allow blood to be drawn out to be cleaned and returned. The vascular access is usually created in your upper arm either using your native vein called AVF, arteriovenous fistula, or a synthetic graft called AVG, arteriovenous graft. It usually takes 2 to 4 months before AVF is ready for dialysis. During the process, the dialysis machine checks blood pressure and control how quickly blood flows through filter and fluid is removed from body. Before hemodialysis, Ms. Janice has been experiencing increased leg swelling and breathlessness due to her kidney failure.
Hey Janice, are you alright?
I have been told that my kidneys are failing and that this is causing me to be breathless and swollen.
After hemodialysis. Hello Ms. Janice, how are you feeling after the last session of dialysis?
After hemodialysis, my leg swelling has improved and I'm not breathless anymore. I can even walk to the dialysis center on my own now.
Patient can utilize MediShield Life and Medisave for the payment of their monthly dialysis. Voluntary welfare organization and government subsidies are available to provide further subsidy for eligible patients. You may speak to the renal coordinator to know more about the charges for dialysis treatment. Here are the advantages and disadvantages of hemodialysis. Advantages would include that hemodialysis is not a daily treatment, diabetic control is not affected, and it is done by trained nurses at a dialysis center. Moreover, there are no requirements for storage of dialysis equipment at home. Disadvantages would include that being on hemodialysis means that you need to have your own transportation to the dialysis center, less flexibility with schedules. You may also experience pain with needling. Risk of infections, stricter dietary restrictions, and some may experience discomfort such as nausea, tiredness after dialysis. The last available option for end-stage kidney disease patients is kidney supportive care. Not all patients would view dialysis as a way of life, and kidney supportive care can be their next choice as it involves the provision of medications to alleviate symptoms associated with kidney failure, to continue to support the patients till they pass on and maintain quality of life. In spite of dialysis or transplantation, as we age and our bodies become more frail, conservative management may be required subsequently. Advanced care planning can also be done to discuss future care preferences between an individual, their family, and healthcare providers. So, still have questions on which treatment to choose? You can always talk to your renal physician on which treatment might be best for you. Factors to consider would be lifestyle, medical conditions, and personal preferences. Discuss with your family early and avoid delay in decision making for your treatment.